Hi there, good day. I'm Jim Lawson. Thank you for joining us to discuss the ABC accreditation process as it specifically pertains to mastectomy-only facilities. Now, please note that there will be a quiz available for those of you who are interested in receiving 1.5 continuing education business credits for this presentation. Simply click on the corresponding link on your webinar library page and take the quiz. But before we get started, I'd like to look at our website at abcop.org, where you'll find all of the items we're going to be discussing today. So let's go ahead and take a shot at our website here. One of the most important places I think all facility compliance officers need to know how to access and use is your facility's My ABC account. Now, if you take a look up at the right-hand corner, you'll see that login box labeled My ABC. That's where you log in with your accreditation username and password. Once you log in, you'll find so many helpful items for maintaining your accreditation. You'll also be able to make changes and updates into your account. We have listed here some of your facility profile, right? We have your current accreditation information. You can pay your annual fees right there. Your ABC certified personnel will be listed, and any affiliate locations if you have them, and of course the resources to help you. Now we'll go deeper into those very shortly. In our webinar today, we have a lot of information to share with you about the accreditation process, how it works, what you can expect, and how to be successful. So some of the things we're going to cover: the accreditation application process, the many resources we have available to help you comply with the standards, what to expect during your on-site accreditation survey, and what to expect after your survey. We'll look at the highlights of your compliance standards and how they apply to your business. We'll cover the why, who, and how of privileging and how it can benefit your practice. We'll also take a look at mastectomy fitter certification eligibility requirements. And lastly, we'll talk a little bit about how to promote your accreditation to your community and your potential customers. So, we've got a lot to cover. Let's get started. Before we can do anything, we first have to apply for accreditation, right? So let's start with the accreditation application process. Let's talk about timing. If you're applying for facility accreditation with ABC for the first time, whether it's a new business or possibly a second location, affiliate location, or you're moving, we encourage you to apply for accreditation only when you're ready for an on-site survey. Meaning, if you submit your application, you're telling us that you are ready for an ABC surveyor to conduct an on-site survey at any time. Now, we're going to do our best to get you surveyed as soon as possible if you're in that situation. The probability is within 90 days, so that you can get your mastectomy business up and underway. Now, if you're renewing your accreditation, we'll remind you both by mail and email when you need to apply, which is approximately 6 months in advance. The last thing we want to do is for your accreditation to expire. Once your renewal application has been approved, it can take a few months to schedule the on-site survey. Paperwork must be processed, and survey assignments and travel have to be coordinated. We'll give you a 4-week window when your surveyor will be arriving, so you can see why we require that you apply early. We want to make the facility accreditation process as efficient and as uncomplicated as possible. So, how do you apply? The application process must be completed online through our application portal, which can be used on the ABC website at abcop.org. You can get there either by logging into your facility's My ABC account, remember how we did that earlier, or by clicking on any of the Apply Now buttons under the Facility Accreditation tab on the home page or any of the facility accreditation pages. These buttons will take you here. If you're applying for first time, you can click on the Apply Now button under the Facility Accreditation tab or on any of the facility accreditation pages. If you're renewing your accreditation, which is probably most of you, simply log into your facility's My ABC account. Now remember that's your facility account, not your individual certification account. That's very, very important. And start the application process there. But if you happen to land on this page, you can also click the Renew Now button that will prompt you to log in. There's going to be a documentation submittal requirement before your on-site survey happens. Now, all required documentation must be uploaded directly to the application portal. For those of you that still have documentation in paper format, please don't worry.
Every life we have some trouble. When you worry, make it double. Don't worry. Be happy. Don't worry. Be happy.
Oh, Bobby, thank you so much. As Bobby said, don't worry, be happy. It's okay, we're here to help you. Now, there are several options for making your documents electronic files. If you have a scanner built into your desktop printer, simply scan your documents into your computer as PDFs or image files. If you don't have a scanner, you can take your paper documents to a local copy and print center like FedEx, Staples, or Office Depot, and have your documents quickly scanned and either emailed to you or placed on a flash drive that you take with you. Now, while it may take a little time up front to get your documents scanned, you will then have electronic versions that'll be easy to search through, and if stored in the cloud, will ensure that they won't get lost, they won't get damaged, destroyed. That is great emergency planning. Now, while we're here, let's take a look at the list of documentation ABC's accreditation team will require you to submit through the portal. These are what they're going to require. Certifications and licensing for all non-ABC staff, if it's applicable. Your legal documentation of ownership, such as articles of incorporation, IRS tax forms. Your certificate of occupancy, which would include your business license, certificate of operating license, your certificate or sales state tax, your policy and procedure manual and employee handbook, and your business mission statement. Now, it's very important that you carefully complete your application. Please pay careful attention to every section. For example, put your correct hours in, because if you say you're open at 8 a.m. and the surveyor shows up at 8 a.m. but you actually don't open until 9 a.m., then that's going to be a problem. I'm going to ask you to be very specific about the services you provide, both for your primary location and your affiliate locations if you have them. If you put on your application that you perform a certain service, then the surveyor will want to see evidence of that. So don't check off something that you don't offer. The application is also the best place for you to share any information that you feel we should know prior to your accreditation survey. For example, if you see patients by appointment only, we need to know that. Remember, be prepared before applying and make sure the application is filled out completely and correctly. You will receive an email when your application has been accepted. Now, this is something you may not be aware of, but ABC offers blackout dates. Blackout dates are any dates that you have designated as no survey dates. In other words, even if it falls into your survey period, we won't survey your facility on any of the days that you have to let us know in advance that you have it, or you or other key staff members will not be available. We want to work with you on this. Now, this can be very helpful if you already know that you have a wedding to attend or a vacation planned. To guarantee accommodations of your blackout dates, your request needs to be submitted to ABC within 2 weeks of the date your application is received. All requests for blackout dates must be submitted via our online blackout date request form by the deadline provided in your facility's application receipt email. You'll receive that in the email you get. For your accreditation, you'll be allowed a maximum of 10 blackout dates during a 6-month period. Now, this will go into effect February 2023 during your accreditation period. You'll receive an email notification that your site is due to be re-accredited. The link to that blackout date form is also included, as I said again, in this email and must be submitted online. Now, you can also get the form by logging into your facility's My ABC account. That My ABC account, you're able to do everything there. Unfortunately, the accreditation team is unable to accommodate blackout dates submitted after your application deadline. And blackout dates will not be able to add on to your affiliate locations. Now, as I mentioned before, we want to get those locations up and running and as fast as possible. Now, let's tackle the resources and standards. Where do you find them? Right here in the Mastectomy Facility Accreditation Guide. The guide is available as an online publication at abcop.org. You're going to have that website memorized by the time we finish, if you don't already have it memorized. You can quickly go from section to section and use Control F key on your keyboard to search for specific terms, right? From administrative standards to those related to claims and billing, they are all right there in the online publication. I encourage all of your staff to read it, review it as needed, and revisit it as you prepare for your on-site survey. The guide contains all of the 43 compliance standards that a mastectomy-only facility needs to comply with. It also has many other resources which I'm sure will be very helpful. We'll take a look at some of those. So also in the guide is the Patient Care Accreditation Pre-Application Checklist. This is your basic cheat sheet for your survey. This is what the surveyors will be looking for when they arrive. I would take this list with your staff and I would walk through it prior to submitting your online application, making sure you are completely prepared for your survey to arrive. Now, the guide isn't the only tool and resource. On our website, we also have the Relevant Standard tool, the Compliance Kit, an online resource pack, our webinar library. This will be included in that. Our Credcast podcast library, the Facilitator e-newsletter, the Top 10 Items Overlooked flyer, the What to Expect During Your On-Site Survey flyer, online FAQs, and Medicare resources and links. Basically, abcop.org has a plethora of helpful information. Let's go back and take a look at where some of these resources reside on the website. Here's the Compliance Kit, where so many of the helpful tools I mentioned reside. For example, the Accreditation Compliance Calendar, which we send out each year to all ABC accredited facilities. Each month we focus on different areas to help you be compliant. You'll also find the Accreditation Resource Pack. Let's talk about that. The Resource Pack contains 27 charts, templates, information sheets to help you be compliant with the ABC standards. Now, the first year we started doing this, we had just a handful of them, and the resources grow every single year because people like you reach out to us and request or suggest more tools. So please let us know what you need, and we're going to do our best to get them there for you. As we continue to prepare for this survey, we need to let you know that because ABC is a Medicare deemed authority, our accreditation surveys must be unscheduled and unannounced. We have to follow their rules, but as I mentioned earlier, we'll be giving you a 4-week window of when we'll be arriving. And to keep their time in the office at a minimum, the accreditation team will be requesting, as I mentioned before, some of the documentations to be scanned and uploaded and sent to them prior to the survey. This is the list we discussed earlier. We want your facility and your staff to be prepared. Let them know we're coming. We'll also need a contact and a backup contact and a cell number for that backup contact. There have been different times when we've arrived or a surveyor has arrived at an office which was closed. We called the backup contact and we heard the phone on the other side of the closed office door ringing, right? So that's not going to help anyone. That's why we asked for a mobile number. So you've completed your accreditation application online and it's been accepted. Now what? Let's talk for a few moments about what your survey will look like. When your surveyor arrives, they'll introduce themselves and show you their ABC badge. They'll do a brief meet and greet with your staff and a brief tour of your facility. They'll need a workspace. An office or an unused exam room will work great. If you're using EMR, electronic medical records, they'll need a monitor to access your system. They are very well versed on the software in the profession that we use, and even if you have created your own database system, it'll just take them a few minutes to get up and running. They're going to ask for some very specific documents and personnel files for each staff member, and at least 10 patient records for each certified mastectomy fitter that you have on your team. Now, I say at least 10 because they may request more, depending on the patient load you have over the last 6 to 12 months. Now, some of you may be wondering how you're supposed to get 10 patient charts if you haven't yet been accredited, right? You're opening a new location, opening a new business, and you can't bill for your services yet. Now, our accreditation team will work with you and help you with that issue. Don't worry. Again, like Bobby McFerrin said, just let us know if that's your situation, and we will reach out to help you. If you have Medicare patients, the survey is required to call 5 of them randomly and ask some very basic questions. And I'm going to show you those questions in just a few moments. Now, at the end of the survey, there will be a closing or an exit interview with you or your designated staff person, and we'll talk about that shortly also. As I mentioned those questions for the Medicare random phone calls, here are some of those basic questions. Were you given information on the function and care and use of the device? Were you told of the benefits and precautions of your device? Were you asked to make up a follow-up appointment? Were you provided contact information? And do you have any further questions? Now, when we talk to the patients, and if they would like to make an appointment, our surveyor will be very happy to hand that phone call right over to a staff member of yours. And if they're all busy, then they'll take the specific information down and make sure your staff receives that so they can call them back and make an appointment. So why don't we take a look at some of the most missed standards that ABC surveyors find during their surveys. We update this list quite often. We get a chance to talk to our surveyors and they see trends of things that are being missed. So this is very beneficial. I would have to say that most of the issues that we find are because of lack of documentation. We've all heard that if it hasn't been documented, it hasn't happened. So what is the key to validation? Document is the key to validation and to accreditation and to compliancy. The first issue they often find are incomplete patient charts, and we're going to stick with this for a little while. If your surveyor finds something missing, they will walk through the steps that you need to implement to ensure proper documentation going forward. This is also a great teaching opportunity for you and your team to understand exactly what is needed in the patient charts. So some of the missing documentation they discover involves the in-person clinical exam, the established goals and outcomes and documentation of the items, and making sure the services are consistent with the prescription itself. Has it been documented? Here's the thing. I know that each of you, everyone listening to this, are doing all of these things. We know that. But the question is, have they been documented sufficiently? See, that's the key, and that's what can trip you up. Have you formulated the treatment plan? Of course you've done that. Has it been documented? Have you established goals and outcomes with your patient? I know you have, but once again, has it been documented? So sticking with the patient records, was the product delivered in a timely manner? Did you tell your patient that it would take 2 or 3 days to get there and it actually took 2 or 3 weeks? Did you communicate that issue with your patient? Were the items consistent with the prescription? Was it documented? Do you have sufficient proof of delivery? Let's take a look at this. We're looking for the proof of delivery, the beneficiary's name, the delivery address, the date, sufficient detailed description of the item or items being delivered, the quantity being delivered, that's important, and even more important, the beneficiary's or designee's signature. Have you given the patient instructions on the device or garment? Have you explained how to maintain and clean the devices or materials? Have you taught them how to adjust, maintain, clean the skin, and how to report problems? Have you provided follow-up consistent with the items or services and asked for feedback to determine effectiveness? What if they have an issue after hours and they need to reach out to you? Now, have you given them that information? I recently had the honor, I was speaking at a mastectomy fitters meeting in Florida, and as I was talking about this, I had a person ask me, a bra emergency? Well, I reminded the attendees that many mastectomy fitter businesses offer more than just bras, such as compression garments and other things, etc. If needed, have you followed up appointments with your patient? Did you review or make changes to the treatment plan? If so, have you documented? You can do that. You're the expert. You're the person in charge. And if you need to make changes, you can do that. Make sure it's documented. Did you review the recommended maintenance with your patient? Did you solicit feedback to determine effectiveness from your patient itself? Document that information. So, to help you with all of those questions and to help make sure that your documentation is all in place, we have created the patient chart audit template right here in front of you. It lists the documentation which you must have and helps to make sure that you do have that documentation. Use this as to do a random chart audit. See what's missing. Pull charts out. Take a look, see what's missing. Then do another random chart audit a few months later. I guarantee you that the list will get shorter and shorter, each things that are missing every time you conduct an audit. Let's talk about privileging. This is an item that our surveyors sometimes find issues with. So, what if getting an employee certified isn't in the cards right now? What else can you do to help lighten your load? You can consider privileging an employee. Now, I think that would be a perfect time to discuss this sometimes confusing topic. What is privileging? Well, privileging is when a staff member is allowed to perform a service beyond their scope of practice with appropriate supervision. They need to be trained and educated in certain diagnosis and a certain device. And let's go a little deeper into that. In the mastectomy profession, an ABC certified mastectomy fitter may privilege an employee who is not credentialed or certified. That privileged staff member must have a written objective criteria. Now, this is telling the story of their privileging. The training which they have received, the justification of why they're privileged, and all of this must be documented in the employee's personnel file. The documentation could be one of many different forms, including, but not limited to, proof of completion of continuing education courses related to that particular item, documented in-house or in-service training that is specific to the items or services that the patient care provider is being privileged to provide, and or documented specific work experience, participating in patient care activities. You will need written documentation for each privileged patient care provider, describing what criteria they met and how they met it. In our resource kit, we have a few tools which can help you greatly with privileging. The first is on establishing privileging criteria and the privileging guide. We even have an individual privileging record template for you to use. There's the employee's name, the supervisor, the date, what they're privileged in, their experience, their continuing education. Yes, you still need to have continuing education if you're being privileged, and their in-house training. This is one of those 27 charts and forms and templates we have provided for you. As the privileged employee supervisor, you have responsibilities. Signing off on notes. This is a simple standard that some facilities miss. When a non-credentialed staff makes notations in the records, the patient's chart, the following must occur. A credentialed supervisor must review the notes, co-sign the patient's chart, and then review the signed and sign off, and dating must take place within a 15-day period of first when the notes are placed in the records. A chart review process must be in place to ensure this procedure is not missed. Now here's a little tip. By signing and dating the notes, the credentialed supervisor is saying that they agree with what the privileged employee provided. The buck stops with you, the supervisor. So if you feel your staff member needs more training and experience, then I would suggest making sure that they have it before they are privileged. Another area surveyors find issues with are patient satisfaction surveys. First, why do you think we do them? Well, you could think it's because Medicare and ABC makes you do them. Well, yes, that's true. But even though that's true, there's a far better reason. So you can provide the best health care possible. How are you going to know how well you're doing without feedback? And the best people get feedback from are the reason you're in business. They're your patients. So who needs to receive a patient satisfaction survey? All of your customers should receive them, and all of your patients should receive them. You can offer them in different ways, electronically or by text or email. You can offer a hard copy in person. You can mail them out. You can have electronic tablets such as an iPad right there in your business where they can fill it out. Offering more than one way is probably the best idea because you have all different types of patients of ages and such. Some of them will use emails and texting. Some don't. Some don't like to use it. We need to make sure the survey is accessible to all of your patients. The questions on your survey need to be relevant to the services you provide. They need to be timely so your patient can be honest and specific about their interactions with you and your team. Now, I also think it's a pretty good idea to take a few moments and explain the importance of the surveys to your patients. Take a few seconds to let them know that you need to know how you're doing and how your business can improve. I think if you use these tips, you're going to start receiving even better feedback than you have been receiving already. Now, we have our sample patient satisfaction survey in the resource pack, which can help you get started. Since it's a Word document, you're able to customize your survey and include the products and services you offer. Now, we have yet another set of resources to help you with, including a guide to patient satisfaction trends that's in the pack, how to write and analyze patient satisfaction surveys, and this is what we're looking at right now, a sample patient satisfaction survey. If you have a survey that works for you, great. You're pleased with it, stick with it. But if you'd like to use the one we created, or maybe even take a few questions from it, go right ahead. We even have a sample referral thank you card in the resource kit. What do you do when a patient satisfaction survey starts coming in? You're getting bombarded with them, which is fantastic. First, read them, evaluate them. If someone is taking the time to share their input with you, please take the time to read and evaluate their responses. What will you do with the responses? Remember, they can be extremely beneficial on how you operate your business. The surveys can be anonymous, and if a patient decides not to let you know who they are, then you probably should respect their wishes. But if a patient with an issue gives you their contact information, I would reach out to them and try to rectify the issue the best way you could. Now, we all know you cannot make every patient or customer completely happy, but you can listen to them and let them know you understand their issue. You can learn so much from these surveys about your services, about your products, about your staff. This is also a good marketing opportunity. If you're hearing that 98% of your patients are thrilled with your services, then that would be a great fact to share with your referral sources. You can put together a short letter or a card thanking your referral sources and letting them know the positive results of your survey. You can also tout your satisfaction rating on your website or on Facebook page. Now, one thing here, mastectomy facilities are not required to create a report and action plan with the results of your patient satisfaction surveys. But I'm just telling you right now, it's not a bad idea to do that so you can have a record of what you learn from them. Okay, next up, facility safety. This is one of the simpler standards, and though it's very important, it sometimes gets overlooked. Fire and emergency drills. Are you doing them? Hopefully you are, but they're easy to forget during your busy work schedule. Let's take a little pop quiz. Don't worry, I cannot see your answers. How often should you conduct a fire emergency drill? Well, Facility Safety Standard 3.2.1 requires you conduct a drill at least once a year. Now, I know of some businesses that do it 2 or 4 times a year, but you'll need to document that you've done it at least once a year. Next question. Who needs to be involved in the drill? How about every staff member? If you have employees who work part-time and they're not there on the day that you hold the drill, you'll have to do another one when they are present. So you may hold the drill if you have patients or customers in your practice, but be nice to them. Let them know it's a drill beforehand. And let's go to our last question. Do you have to conduct a drill if you are the only employee? The answer is yes, you do. You need to have a scenario and a practice it at least once a year, as well as document that drill. Let's look at safety inspections. As you find so often with ABC, you'll need to perform these at least once a year. And it's not a bad idea to have someone you trust walk through with an extra set of eyes to see if they spy any safety hazards. Someone maybe who hasn't been in your practice for a while, or someone who isn't always in your facility. Some of the issues we find are fire extinguishers not fully charged. We also find loose floor tiles, frayed carpeting, exposed electrical cords and wires, and safety covers missing on not used outlets. These are some actual photos from a facility during accreditation survey. This is one from an O&P practice. They had 4 fire extinguishers, and 2 of the prostheses behind a door. When the fire happens, do you put it out with a fire extinguisher? Do you beat it out? We're not sure. They had this famous fire extinguisher / doorstop up in the right-hand corner, yes. And then the fire extinguisher that they're actually using in the very bottom right-hand corner was completely dead. I don't know why they had all these extinguishers, but they are dead. Please do me a favor. Check these as you walk by them. You walk by them every single day. Take a peek. Make sure that they are all filled. These can leak sometimes, and they're your first offense in a fire. So when your survey arrives, they will ask for the documentation that you've completed the drill. To help with that, we've created a fire emergency drill documentation template. This is one of those 27 sheets and forms. There's a place for the date, who attended, the start time, the stop time, and the scenario. Let's move on to policy and procedures. Every ABC accredited facility is required to have a policy and procedure manual. Now, this is something that will be reviewed during your accreditation survey. Most businesses have one. I think every business has one. Pizza Hut has one. Google has one. Your local daycare provider has one. All of these places have some sort of policy and procedure manual. They can be called your policy and procedure manual. They can be called an employee handbook, whatever you'd like, but you must have one. So your policy and procedures need to describe how your mastectomy business and fittings are performed. Your manual needs to be accessible to all your staff, and it needs to be current. You'll need to inform your staff about policies as well as any changes you make in the future, and make sure that you document those changes. You can do so by adding a page to your policy manual and stating the effective date of the change. For instance, something you learn as a result from your patient satisfaction surveys may elicit a change or changes. You need to document that change. And remember, it must be reviewed at least once a year. You must, at least once a year, review your policy and procedure manual and document that it has been reviewed. When it comes to claim and billing standards, there are some critical elements you need to be aware of and follow. You need to establish a claims and billings compliance program based on formal policies and procedures that prevent inappropriate billing. Now, you'll need to have a qualified and trained individual responsible for maintaining your compliance program and overseeing that the program is administered consistently. Maybe that's going to be you, but if it's another staff member, they need to be properly trained and educated on claims and billing procedures to effectively manage the claims process at your facility and minimize the submission of improper claims. Auditing and monitoring mechanisms are implemented to ensure consistent compliance and identify areas of improvement. Now, to help with this last point, we've created a template just like the patient chart audit template, but this one is for billings and claims. You guessed it, it lives in the ABC resource pack, and it's called the Billing and Coding Error Report. If you document any issues that arise in your billings and claims on a report such as this, you'll be better equipped to identify and correct them in the future. And this creates a great opportunity to further train staff members. The more aware you are of your errors, the better you'll become at fixing and preventing them. Some of the other annual compliance checklists we have in the resources for are corporate documentation, employee documentation, the office and reception area checklist, annual reviews, patient information and forms, patient exam rooms, performance management, fire and safety, and billing and coding. So that's a wrap. Actually, not of this webinar, but it's a wrap of your survey. At the end of your survey, the surveyor will provide you with a closing or exit interview to review their general survey findings. The interview can be held in 3 ways. Their first choice, is to have the interview with the business owner or manager in person at the end of the survey, right there at location. If you are with a patient or unavailable, then another staff member can come and do the interview and take notes. That would be the second way. The third way is to have it by phone on one of the next or following days. Please don't forget, your patients take precedent, and if they need your attention, we want you to attend to them first. A closing or exit interview is your opportunity to meet with your surveyor. It's a time for you to review any partial or non-compliant issues your survey may find. They will share with you their findings, and it's an opportunity for you to share any additional data or information that may have not been readily available during the review. For example, during a closing interview I was on with the surveyor told the business owner at the exit interview that they were non-compliant on a standard because they were not able to find the documentation. The owner left the room and returned in 3 minutes with that exact documentation we were looking for. The surveyor then reminded the owner where to keep that documentation and marked that they were compliant in that standard. We were there to make sure that you're compliant in the standards that apply to your businesses, but we also have a very consultative approach with you and your team. We're also there to help. Now, they're also there to show you positive findings and give you ideas of how you're doing. And if they see something great your staff member's doing or you're doing, they're going to let you know. It's your opportunity to share and receive information. Now, remember, the standards themselves, which you need to be compliant in, are basically best business practices to help you provide the best healthcare possible. The surveyor will not be able to tell you if you passed or not during the interview, but this is the time where ABC's consultative approach serves you well. Your surveyor will make suggestions on different policies and procedures and how you could save time and money by making these changes. Now, our surveyors see the process of many facilities, and they have a lot of insight to offer. Okay, so now the surveyor's left. You take a deep breath and you realize it really wasn't as difficult as you thought, right? So what's next? Your surveyor will review and complete your survey after they exit your location. Once it's complete, it will be sent to ABC's offices to review, validate, and finalize. Your finalized results will be sent to your primary contact within 2 to 4 weeks of your survey by email. You'll receive a written summary of findings along with your survey report and a decision letter. The report will indicate a score of compliant, partially compliant, or non-compliant for each standard for which your facility was surveyed. Standards marked with partially compliant or non-compliant will include comments to assist you in taking corrective action to be compliant with the standard. Your decision letter will also inform you of a corrective action plan or a CAP if it is needed. If you receive a request for a CAP, it doesn't necessarily mean you didn't pass your survey. It just means that you'll need to show us how you have made changes to be compliant. We give you 60 days to make the changes, document them, and send the CAP to us for review. Return them on time and be very specific in your response. Now, that doesn't mean you should send your entire policy and procedure manual to us if that's what you need to correct. Believe me, that's happened. If you have any questions whatsoever about your CAP and how to write it, don't hesitate to contact us, and we'll explain exactly what is needed. So, congratulations! You've passed your ABC accreditation survey either for the first time or renewal. Yay! Now what? You'll receive your ABC accreditation certificate, which must be placed in an area where everyone can see it. Most facilities hang it in their lobby or reception area. You'll also receive an ABC accreditation window decal and information about the ABC logo and how to use it. Many ABC accredited facilities place it right on their homepage on their website to show that they've achieved ABC accreditation. Now, let's go ahead and cover someone who can become an ABC mastectomy fitter. What I'd like to do is I'd like to go to our website. Let's go ahead and take a look at our website here. Okay, so let's look at the website. As I mentioned, we're going to abcop.org, and you probably have that memorized. If you look on the top bar, we see individual certification. Let's click on that. And now we're going to scroll down a little bit, and this is the list of all of the disciplines we offer certification in, and we go all the way over to the right to mastectomy fitter. Click on that and scroll down a little bit. Now, there's the overview, and here's eligibility. Let's click on that. So, one of the main things for eligibility is your education requirement. First of all, everyone has to either have one of the above, a high school diploma, GED certificate, or a college transcript. Okay, and the next thing you must have is completion of an ABC approved mastectomy fitter pre-certification course. Now you may say, Jim, where can I find one of those courses? Well, we're going to put our cursor right here. If we clicked on that, that would bring up a whole list of all those courses, where you may take them, their schedule, the fees, and everything along with that. So all of the information is right smack there. So let's take a look under the experience for pathway number 1. Now, under Pathway 1, a candidate will need to complete 120 hours of supervised mastectomy patient care experience either before or after the completion of their pre-certification course. That's the course I spoke about. Any experience with initial patient evaluations and final fitting or deliveries involving a mastectomy form must be done under direct supervision. Now, direct supervision is when the supervisor is there on site with the candidate. So let's take a look at pathway number 2. Now, pathway number 2 is for those individuals who already have a nationally recognized certification in related allied health professions, such as an RN, an LPN, medical assistant, certified breast care nurse, oncology certified nurse, certified breast patient navigator, and just a whole slew of those, etc., etc., etc. So these candidates only need to complete 60 hours of supervised mastectomy patient care experience, either also before or after completion of their pre-certification course. Let's talk about the certification exam. Now, it is a 2.5-hour multiple choice exam consisting of 125 items designed to measure the candidate's knowledge of mastectomy fitting. Knowledge assessed on the exam includes patient assessment, formulation of a treatment plan and implementation of that plan, follow-up care, practice management, ethics, and professionalism. The exam is computer-based and is offered every other month at 350 locations nationwide or online with a live remote proctor. The candidates can drive to a testing center and take the exam, or you can take it from your home and have a live proctor. At the end of the exam, the candidate will receive unofficial results right there on the screen. It will say pass, right? That's all we're hoping for. We thought we'd offer a little help on promoting your accreditation also. In your accreditation package, you'll also receive a sample press release template, which ABC has created to help you share the news about your accreditation accomplishment, all the hard work you've done, and let everyone know that you've met the gold standard for the profession. You can also find this template in the resource pack, of course. You can find everything there, right? Who would you share this information with? Well, how about your referral sources, your physicians, hospitals, your VA centers, or even how about this? Your local newspaper. I've had different people tell me that they've sent this into their local newspaper. They've had people come out and do an article on them. That's free publicity for them. Let them know that you provide the highest level of healthcare, and you'll have the proof with it with your new ABC accreditation certificate hanging on your wall. ABC Satisfaction Survey. ABC practice what we preach. We are always looking for ways to improve our services, and after your survey, we will ask you to complete an online ABC satisfaction survey. We'll send it to you with an email. That's the way, since we have your contact information that way. Just as your business, we want to continue to improve our accreditation process. We want to make sure that ABC is doing better and better every year. Take the ABC email satisfaction survey to help us serve you better. This is the Facilitator, ABC's quarterly e-newsletter that you'll be receiving as an ABC accredited facility owner. It contains Medicare update sections, surveyor notes, update trends in the field, and information you'll need to maintain your accreditation. I would take this and I would send it and share it to each staff member to make sure they read it. We are all over social media, and we post articles and events that you may want to be informed about. Let's see if I can name them all here. We're on YouTube, Twitter, Instagram, LinkedIn, and Facebook. If you're on any of these medias, feel free to follow us. Your best resource is the ABC staff. ABC is the leading accreditation organization for our profession, but we're more than that. We're here to help you succeed. We are available to answer your questions, to help you through your first survey, as well as your accreditation renewal process. So, here's our awesome accreditation team. Tammy Richards is our Director of Facility Accreditation Services. Christine Michaels is our Manager of Facility Accreditation, and Kyle Sins is our Standards and Compliance Specialist. Please feel free to reach out to them anytime. Just email them at accreditation@abcop.org, and the appropriate expert will respond to you. Please don't forget, one more time, documentation is the key to validation. Document everything. If you haven't documented it, it hasn't happened. Thanks again for joining us. Please don't hesitate to contact me or any of our accreditation staff. We are here to help you and answer any question you may have. Here's my contact information, but also here's the accreditation team's email, accreditation@abcop.org. Don't forget about the quiz. Just click on the link next to this webinar in our webinar library. Get those 1.5 CEUs. They all add up. We thank you so much, and I hope you have a wonderful day.